Well, hello and welcome to the live stream today. My name is Holly Foxworth. I'm a registered nurse here at Axiom and also the marketing manager for content. So I'm thrilled that you guys have joined us, taking our questions and providing some best practice tips. We do have Chief Marketing Officer Dara Wheeler and Chief Medical Officer Dr. Scott Cherry. But before we turn things over to them, I wanted to first just kind of take a second and thank all of you for the questions that you guys have been submitting through this week. We've received comments from email, we've had them in the webinar, and then also we've been getting tweets as well. So please keep those up. We definitely love to hear from you to know what your interests are, what your unique needs are, etc. I also wanted to mention to please keep an eye out for an email or on our social channels about the next webinar that we're going to have. It's going to be this next Thursday, 1:00 p.m. And the title is actually Mental Health Instability for a Workforce in Crisis. So as I mentioned, you will receive an email, and then you can also sign our channels there, but this will be a great webinar. I'm really excited about it. I think it's really going to kind of blow your minds and kind of make you think of things in a different way, because there's a lot that's going on. We have a psychologist that's going to be there as well. A lot of pieces to kind of plug into the puzzle there that relate to both COVID-19 and mental health. So we definitely want you to join us for that. All right, well, let's go ahead and get started. I'll let you guys introduce yourself, and then we will jump into some of the questions. Dr. Cherry, you want to go first?
Sure. Thanks for having me. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. I'm a board-certified preventive medicine public health and also board-certified in occupational environmental medicine. Those specialties focus on population health and specific hazards in the workplace, how to certify employees fit for duty, and a lot of the administrative medical issues around employment in the United States. Dara?
Thank you, Dr. Cherry.
Awesome.
Very nice to be here with everybody. Sorry, Holly, I didn't mean to cut you off. My name is Dara Wheeler, and I'm Axiom's Chief Marketing Officer. And I'm very happy to be here discussing the follow-up questions from our webinar last week.
Perfect. All right. Well, before we use questions, I did want to kind of ask if you could, one or both of you could comment on the CDC statement that we had that came out that was related to exposures past vaccination. Would one of you want to walk us through that, maybe what some of the implications would be there?
Sure. So I think, either last night or early this morning, the CDC had released some guidance regarding how vaccination may affect the need to quarantine for those that are exposed through a close contact source. So the way the guidance is read, there are 3 criteria that have to be met. The first one is that the person has to have had the complete series of vaccinations, and 14 days have had to have passed since the final vaccination. So there's 2 series and a 1 series of vaccines out there. So you want to have completed the complete vaccine for whichever one you get. And then the other component is that you have to remain asymptomatic, which is really a main focus that we focus on here at Axiom, as not having any illness in the workplace, regardless of COVID or flu or strep, any of the infectious, just being sick at work is not going to cut it nowadays. And then lastly, which I don't think is highly visible in some of the media descriptions of this, is that this exception only applies for 90 days after the vaccine. So you have to be within the 90-day time period of 2 weeks after vaccination, and then you have this 90-day period. So, what this policy kind of implies to me is that there's some evidence that the vaccine does provide a high level of immunity, but for a short duration. I think what we've discussed on our webinar series here is my impression of the data from the vaccine studies are that the primary outcome of the vaccines is to prevent severe disease, so preventing hospitalization and death, but it there's not really solid data that prevents infection. And so I think this policy is somewhat addressing that, but, you know, with the short time period of 90 days, I do worry that the variants, as COVID continues to mutate, you know, what implications that may have on it. So there is some risk involved with this exception. And so when we discuss with our clients the pros and cons of it, you know, it's a business decision with medical input. And I'll leave it at that. Dara, did you have any other thoughts?
No, I think you stated that really well. I do know that there's some concern in general about everybody's really tired of dealing with COVID. Everybody's really excited to have something positive forward to. So I think behaviorally, we're seeing the vaccine as a major positive in this kind of path forward for COVID-19. But it needs to be with caution. And I think your points are very valid as we think through. And I know our clients and others are really tired of hearing us say it. It has to continue to be that layered approach. And it needs to be that we think through, like Dr. Cherry said, the symptoms, exposures, and vaccine is another great layer, but it should not prevent all of the other great work that people are doing to keep people healthy and safe.
So just to clarify then, because I know we discussed this in the webinar last week. So if you had the vaccine, you can still have COVID-19. You can still have symptoms that would be consistent with COVID-19, correct?
Correct.
Okay. All right. Just to confirm. All right. Well, thank you for commenting on that. I know that we've had several questions that have came in, and I've noticed on social it's being discussed as well. So definitely more information to come on that, especially in terms of best practice and some guidance there. We can go ahead and jump into some of the follow-up questions because we have quite a few. The first one actually came from Elizabeth and was asking whether employers can legally ask employees if they've been vaccinated.
I can start with this, Scott, and then I'll jump it over to you. So we've been talking a lot about this, and COVID is definitely one of the first times we're seeing a bit of a gray area between work-related occupational health program versus somebody's personal health and what that looks like. So the question is, you can ask, but it needs to typically be an opt-in program. Some employers are going down the route of mandatory vaccination programs, and there are going to be exceptions to that and different components based on potentially different employee statuses and things like that. But if you're looking at risk stratification in the workplace and you're looking at occupational health programs, these components of documenting vaccine status become really critical in understanding risk stratification in the workplace. So you need to definitely work with your legal team to determine policy and practice. But in terms of the way we're working with organizations, it's and we talked a little bit about this last week too. It's helpful to work with a third party that can gather that kind of data that's protected health information, whether you view it from a lens of personal health or from work-related health. Dr. Cherry, any additional comments there?
You know, I agree totally what you've said, and it reminds me of things in the past. It's hard to put context around, but what I worry is that, you know, before COVID, it was very clear that, you know, employers could not ask for personal medical information. With COVID being kind of this catastrophe, I would say a lot of our customary practices with regard to communication, documentation, privacy have softened culturally. I don't think the actual law has changed, but culturally we're in this period of acceptance of that. But I worry over time, you know, if the culture or the ambiance of the gravity of the situation kind of dissipates, then it's, hey, you're not following the letter of the law, and so you're in violation. I don't know if it's the background of me being in the military and kind of being held to kind of regulations without interpretation, but it's just something to be mindful of. And so I think your comments there are spot on about making sure you still are respecting that as best as possible.
Yeah, good information. And just a follow up on that, I did want to ask. I saw a question about this on one of the message boards, but the question was if the employer if they would provide the vaccine for their employees, and the employee does not take the vaccine, even though it was offered to them for free, could the employer then, if they were to come down with COVID-19, could they say that we tried to prevent this in the workplace, but the employee was exposed because they made the decision not to get the vaccine? Any thoughts there?
I think it's like what Dr. Cherry just said. It's almost too early to tell at this point. I think it really needs to go back to policy. You need to have a very clear-cut policy on how to handle all of this. If you're not working with your legal and risk teams on how to manage those types of scenarios, you're going to be faced with those questions pretty quickly. And I do think that having a plan in place is critical. And I do know that a lot of organizations are trying to understand the work-relatedness of COVID, whether certain infections do go on their work comp claims or don't, and why, and how to document appropriately. So I do think this is a question that will come up, and we will need to have a prepared plan for how to deal with it. Dr. Cherry, I don't know if you have any additional insight there.
I had a thought and then I was tracking with you. Give me 1 second to kind of bring that back to my memory. I was going too far down it, but okay, I have it now. So, it's really a legal question, the outcome of that specific question, potentially if it goes to court or something like that. But I say really, the idea is to come up with a best practice to protect your employees as best as possible. And that should really be we always say here at Axiom, good medicine is good business. So good health and safety practices are good business as well. So if you have this culture of employee health, one, you're going to minimize as much as possible those negative outcomes you have to manage. But people still could, in fact, decide not to get the vaccine, but by showing that you have offered as much as possible, I think that drastically helps your legal team if it was to go worst case scenario to court for something like that. But I think from the legal experts I've interacted with, you can never guess what happens in a court of law,
Good point. Yes, agreed. All right, let's see. Chelsea was the next question that we had. And so she was wondering what would be your recommendations in terms of tracking which employees have been vaccinated. She had referenced manufacturing, but I would assume that this solution would be similar for all industries. Either one of you?
Dara, do you have any ideas to start with?
Yeah, I think number one, our advice is definitely to come up with a way to track it. And I think it goes back to working with a third party to make sure you're dealing with personal health information appropriately. Although, like Dr. Cherry suggested, the lines are a little bit blurred right now. The laws have not changed. So making sure that your HR and legal teams have a good repository for tracking, whether that's internal or with a third party, is really important. And I do think it goes back to whether you're viewing this as a personal health program or whether you're viewing this as an occupational health program. And when you're viewing this under the lens of occupational health and in the workplace, then you do have a kind of a different duty to track and understand your populations. And I do recommend usually using a third party just because they're used to tracking this type of data and protecting it. It doesn't have to be with Axiom, but I do think that having somebody help you understand that data and what that means for you as an organization is important. Dr. Cherry and I talk a lot about population health and understanding both at an aggregated level and at an individual level that health data. And there's a lot that could be said for future trends in population health and understanding underlying conditions, what that means for both individuals in the workplace and the populations in the workplace as vaccine status evolves, as these variants evolve, infection rates. I do think that the data will become critical in how we protect people moving forward. So my recommendation is to definitely partner with somebody that's used to tracking this type of information and providing insight back to employers. making sure it's protected in the appropriate ways from a data security and data privacy standpoint. There's going to be, Axiom uses an application, and we use phone screening and other case management tools to track and gather this information. But, like I said, it definitely goes back to partnering with people and companies used to managing programs like this. Dr. Perry?
Yeah, I'll just reinforce a part that you brought up, which is, to me, what is most important is, how does the company view the vaccine? Are they going to make it an occupational health program and pay for the vaccine and actively manage it? Or are they going to just gather data from employees in a passive manner through their personal health insurance or through their own personal endeavors? Because I do know the law differentiates that in many ways, but I think all the data privacy rules still matter, but there is probably more visibility to, if you designate it as an occupational health program, similar to like a flu program, where that is, at least up until now, still considered personal. But, if a company offers a flu program to, reduce the barriers for vaccination, they do get aggregate data, so they understand which population is protected or not.
Those are really good points. Really, really good points. And I also think because of these blurred lines a little bit, wellness versus occupational health, and that may evolve over time very quickly, but we're not quite legally at a place where that has evolved. So a lot of it just depends on the lens as an organization you're viewing this from, and which kind of approach you end up taking, or what types of employees you have, and what population health it means to your organization.
For sure. Yeah. All right. Let's see. Don, I think was the next one, or actually, I think we had Cecil. So Cecil was actually asking us about whether the vaccines, whether those are being limited currently to something of nurses, first responders, firefighters, doctors, etc. Do one of you have information, maybe kind of talk us through that process on how the classifications and who was supposed to go first with age, et cetera, and kind of go down the line?
Yeah, I can address that. Right now, it's kind of phase 1, which looks at the highest risk groups, which are members of long-term care facility institutions. And just to provide some detail about that, I believe at least 40% of the deaths in the United States come from this population alone. And so really they're at the highest risk for severe disease or death from COVID-19. And then also in phase 1 is frontline healthcare workers. And so I think this question asked specifically about them, but it's another group that's actually even higher risk than this group. And then phase 2 would be those that are kind of what the CDC has designated as a vulnerable population. So those with chronic medical conditions. And so, the list is quite long or complicated, but essentially, if you're under the care of a doctor and you're taking prescriptions, or you know of certain diagnoses, then you would probably qualify for this. If you haven't gotten a physical in a year or in 5 years or longer, it would really behoove you to get a physical to see if you're in the vulnerable population. Whether you have elevated blood sugar, high blood pressure, those two are the most common things that actually have no symptoms in the early stages. Obesity is quite common in the United States, and so a BMI of over 30, which I would say is pretty low, you could say a lot of the population will qualify just based on that. So, and then phase 3 would be kind of everyone else. So that's kind of the general protocol. Let me know if I misquoted something there, or Holly.
No, I think that was correct. I did want to ask though about, there's been a lot of discussion about why different states are making their priorities different, and there's been a lot of talk even this last week about the teachers and that being part of returning to an in-person environment for learning. So is it the state? Can you just reiterate whose decision it is on how each state mandates who will be vaccinated first? Is it the government that lays out the expectations or maybe recommendations, and then the state is the one that would take it from that point, correct?
Yes, that's my understanding. This is really like a federal, state, and then even local government decision. And so there's a lot of variability between states. And so it's a states' rights issue. And that's kind of how I've understood it. So there's not going to be this broad, consistent delivery across all 50 states. And I think even there's going to be inconsistency even in a region or even in the same county, to be truthful, as I've kind of just seen people where there are opportunities to get vaccinated here in Houston, which is a large medical hub for the country. It's hard to know or predict the supply chain. And so I think that makes us more anxious in general. And but I think it's coming. Like I would not overly stress this process because we have very little control over it.
Good points. Okay. Dawn, I believe, was up next. Dawn wanted to know if she could still get COVID-19 if she's had the vaccine.
Yeah, and Holly, we had talked about this a little bit at the beginning of the webinar, and I know you specifically asked me this, and I just kind of gave a correct, but I'll elaborate on a little bit here. So it's tough because I think the average person feels like when I get a vaccine, then I don't have to worry about the disease that I'm being vaccinated for, and that's correct, actually. Like the vaccine will provide some level of protection from the disease. No vaccine is perfect. There are some vaccines that are well established to have very high levels of protection, or almost what I would call 100% immunity or sterile immunity, like measles. With flu, it's kind of the opposite spectrum. The flu vaccine changes every year because the flu does mutate. And depending on the match between the new flu and the new vaccine, you may get 50% coverage or 80% coverage, and so it's kind of a gamble. I think with this COVID vaccine, it's probably more predictable, but the problem is there's not evidence yet that can a provider, whether it's individual one-on-one or myself managing a large population health program, I can't say that the vaccine is going to prevent infection. And, so infection should be drastically reduced. But again, just there's not data on that at this point, So really, we should be operating that infection is possible, even though being vaccinated.
For sure. All right, let's see. Mark, I believe, was the next one that we had. And it seems like that we had something similar to this in the webinar, but Mark was asking about what role artificial intelligence, AI, may play in reducing OSHA complexity. So I know that's kind of outside a little bit of the scope of what we normally talk about with COVID, but either of you have thoughts on that?
Just kind of, it's kind of a broad question. I don't know if he means like artificial intelligence, like predicting or modeling COVID. I probably don't have much to say. Dara, if you have something, maybe I'll be thinking about it if you have something.
No, I think it's an interesting question. I'm assuming he means that with some of these new regulations coming from potentially from OSHA and from the government relating to what we've talked about, infection in the workplace. It'll be interesting. I don't know that I have a whole lot of insight there, but I would assume that automation and AI will continuously look for ways to support improvement of infection in the workplace. Although, I do know we're hearing more and more about the ability of technology to predict infection before it comes. Like, there's news out there now about wearables and technology being able to predict infection before it occurs. But I don't think that's what Mark's asking. I think he's more asking about all of the complexities around regulation and how we manage regulation in the workforce.
Okay. Yeah. I don't have much else to add.
Okay.
Yeah.
Okay. All right. And then Paul was the next and was asking, why are protective measures still needed if our employees have been vaccinated?
So it goes all, really, that question, essentially the root of it is kind of what I just spoke about potentially getting infected when you're vaccinated. And so if there is this potential, and I don't think it's been quantified yet, but I do think there will be data. Some of the other vaccination studies are looking at infection weekly in their population. And so, if the studies are only out like 6 months right now, there may be some certainty there, but, it'd be good to at least know a year out from a vaccine. The measles has lifelong immunity, so that would be amazing. But my gut is that that's not necessarily going to be the case here. But so again, if we don't have evidence that you can't get infected, then the corollary to that is all the protective measures that Dara usually will reinforce for us need to be in place still. So I think that's kind of the crux of it.
Yeah. And just for clarification, Dara, do you want to go through what those additional measures would be?
Yeah, the layers that we espouse every day and every week. You've got your environmental controls. You've got your hygiene. So we still need to wash our hands. And just a funny little anecdote I was thinking about this morning. My grandmother was a school principal, and she always told me the reason she never got sick was she washes her hands a whole lot. So just go back to that good old basic hygiene. We still need to be wearing masks and protective equipment, so PPE. Testing is important to understand infection rates in the workplace for asymptomatic employees, especially. There's a lot of employers that are taking a surveillance approach to testing. We have vaccines now as a layer. And what am I forgetting? We have case management. So case management is really important because as you have infections in the workplace, making sure people go through the appropriate protocol and don't come back too early is really important. And I think I've got them all. Am I missing any, Dr. Cherry?
You said vaccination as well?
I said vaccines. Yeah. So I think I got most of them. Holly, did I miss any?
Yeah.
Yeah.
Yeah. There's so many layers now. It's hard. It's good to reinforce.
What was that, Holly? Sorry.
You're right. I was just going to say, I was thinking that maybe, did we say the daily health attestations?
Yeah. Daily health checks. Yeah, that's important too. Just making sure that before you come into a space that you've had an affirmation of health. I do think that's a great way to reinforce health in the workplace. And I think back to some of what Dr. Cherry said too. Although we are so focused on COVID, we have to just be aware that infection in the workplace in general can cost a whole lot of money and productivity for organizations, not to mention the health of individuals. So it's always, like Dr. Cherry said, good medicine, good health and safety practices are good business because you have really great, healthy, productive, and happy employees. So that's really what it comes down to. So even if vaccines offered a 100% immunity forever, like measles, which would be great, I don't know that some of these behaviors and practices will go away or should. Yeah. And that's something, I know we're all fatigued and really tired of thinking about this, but I don't know that I ever want to go back to shaking somebody's hand and potentially getting strep either. So you never know.
Yeah. And I was looking at an article last night, actually, and they were talking about that of the general public, that in surveys that have been done, that over 50% of them said that they feel like that they'll still wear their mask even after they've been vaccinated and continue that practice moving forward. So yeah, I think everybody's kind of taking a different look at this, and the more precautions you can take, the better, definitely. All right, let's see. We did Paul Rocio, and I apologize if I've pronounced that inappropriately, but was wanting to know if vaccines help produce antibodies. Does a vaccinated person that is exposed need to quarantine?
This is an interesting question because, and this is a little bit of a humor, but yesterday I would have said yes, and then today I would say no. And obviously things aren't that clear cut. And I think we'd actually spent some time on that at the beginning of this, but yeah, I think the CDC guidance for vaccinated personnel that are exposed do not need to quarantine. I think the spirit is there. For me, where I'm supporting some of our clients in critical infrastructure or supporting clients with critical personnel that if they are out, it basically prevents them from their ability to continue to operate. I would probably recommend to be still conservative on this. But I think for general population, it's something to discuss. So if it's for clients that have less critical infrastructure personnel per se, then it's a discussion. But it's a discussion about risk, as our chief legal officer talks about risk tolerance and the criticality of it. But I would still say, in light of the CDC guidance, probably the best answer is yes.
Okay. Dara, anything you want to add to that?
No, I thought that was well said, Dr. Cherry.
Yeah. All right. Let's see. And the last one was from Geneva02377 from Twitter, and had said, because of the new COVID variants, will people need to test after getting symptoms, even if they had just received a second vaccine?
I think long term, yes. Like I think as it sounds, there is a risk that the current vaccine won't protect against the current variants and definitely future variants. And so just going back to basics, like if you're symptomatic, that's something to investigate. Did I not answer it?
Okay.
Let me see. Yeah.
Okay.
So I think it's like 80-20. I think 80% of the time, if you become symptomatic, it's probably not COVID. And we have a CDC guideline that kind of implies that as well. And so you seek alternate diagnosis. But I do think there is kind of this, small but potentially growing over time. If you only have the one vaccine, if it mutates enough, we do see some of the variants, the antibodies, although they're effective, they're much less effective against the variants than they are against the original COVID. So,
yeah. And I think we talked about it last week, but in regards to the variants and the effectiveness, is it still your understanding that we may need to have some boosters there that would be administered if we find that it's not effective for those particular variants, Dr. Cherry?
Yeah, and so the vaccine will provide some coverage for kind of the majority of coronavirus infections, and then it's most specific to COVID-19. And then the variants of COVID-19 show still decent protection, except for, I think, the Brazilian one. But I think they're going to be able to start tweaking the booster to meet the variants. I think that's probably an upside of this messenger RNA technology, actually. So more to follow in practice, but I think theoretically it's there.
I agree.
Dara, did you have something to add?
No, I think that was well said. I think a lot of it is to be determined, but I think we're seeing some, like you said, some positive momentum there on the type of vaccines that we've deployed. So yeah, I do think we'll probably have to use boosters, but to the original question, yeah, we will still need to understand the disease or testing and make sure those protocols are continued. And then as we learn more and as things evolve over the next few years, we'll have to evolve our practice along with it.
Yeah, definitely. All right. Well, great information from both of you. Always, we appreciate you coming on. Any final thoughts or closing remarks before we wrap up?
Go ahead, Dr. Cherry.
You know, as I guess I'll talk a little bit about complacency. Usually when human nature is in the beginning, we focus a lot of our energy on a new stimuli, a new issue, a new topic, and now this has been going on probably almost a year, and so really I think aside from having better information to actually make decisions on, our energy, focus, and wherewithal is probably faltering. So it's good to be conscious of that and not to beat yourself up over it, but then to just be aware and try to start, recognizing that and then trying to change that behavior. I think the vaccines were really, they were really a tool that I thought was going to change a lot. And I think for the general population, we're feeling it would really change the tides. But now we're seeing variants that are starting to elude vaccination. And, so it can be disheartening on top of that. So, I think the main thing is to be aware of our feelings and then to just try to reinvigorate ourselves, have a community to discuss this with, maybe vent. I vent here with Holly and Dara and the other team members at Axiom. And, I'm frustrated at times, but, in general, we are making it through this. And so I hope everyone maintains as much positivity as possible about COVID.
That's great, Dr. Cherry, and leads really well into our topics next week as well. And dealing with community and mental and behavioral health, I do think it will be critical to, like you said, having ways to vent or rely upon your team members and your community to get us all through this. So thank you. Great reminders. So thanks, Holly, for having us, and we really appreciate it.
You bet. All right. Well, thank you for joining us. Just a few quick mentions before I let you go. We do have a new white paper that's available. And so that one is the COVID-19 vaccine guide for employers. That's available right there on the website. You can download that for free. It has some great information in terms of should you start a program in your organization, steps you need to take whenever you're starting a program, etc. So check that out. Also, we want to see you this next week. I'm telling you, you don't want to miss this one. It's specific to mental health that relates to COVID, and this is going to be a whole new ballgame in terms of some of the things that we need to have on our radar that we may have not been looking at prior to this, and especially where the lines are really blurred between personal health and so if you haven't already, make sure that you register for that. You can do it by the email we send. We also put the links on social. Other than that, I think that should do it. As always, if you have questions before the webinar, you can send those to us at the email address coronavirus@axiomllc.com. So thanks again, and we will see you next week at the webinar. Bye-bye.